feedback. You've come all the way from Chennai. In the north, are the teachers good? Not good? What all they taught? Okay?
Yes, ma'am. Ma'am, it was a wonderful session. First, I have to tell that one, ma'am. Because you put so much effort into online class, and you have taken morning one session, afternoon one session, even in night one session. Nobody in this country would take like this.
Correct.
I don't think so.
Correct.
Never, nobody will do that.
Yes.
Even if we come for a session routinely, we are going for a 2 weeks course means also nobody will take this much class. The two great teacher will never take a class at all. But you are taking. I'm so happy for that, ma'am.
आपने ये सीखा क्या? ये बताओ सीखा क्या? ये तो टीचर के बारे में बात हो गया. सीखा क्या?
I joined this course because of you only, ma'am.
No, but what did you learn in this particular course in the first week?
In the male infertility part, when I was seeing in my place, there is so much azoospermia while doing IUI. And I used to centrifuge and I will see that there is some sperms. But I don't know how to interpret that one, how to give the report. That I was having doubt in that. Then I'll tell them, if you want, you can go for an IVF where ICSI will be done. I will refer to the center, correct center. They will go and they will do ICSI and get conceived. Now only after learning to this class, the azoospermia part was very clear, where male total obstructive, non-obstructive. So how to deal with the male infertility, I made it very clear. Initially in my practice, first when I was seeing infertility cases, I just getting the history from the patient. Then after seeing many cases are coming, I made a proforma for male infertility, a separate history taking proforma, I made it. Then for female infertility, I made every proforma ready. So male and female, I used to inquire myself and I'll write every examination finding. Male examination part, I'll ask my husband to fill it up everything and give it to me, so that he will not be neglected at any cost. Because here most of the patients are male patients. And here in my place, I see many patients, already they'll come with letrozole or with a clomiphene cycle, they will be triggered. But there will not be, no planning will be there, no follicular tracking will be there, no HCG proper given will be there, nothing will be followed. There will be a time, they will be inducing a female who's having a azoospermic male patient. And the unnecessary injection was given for the patient. Almost 6 cycles she has taken. I was shocked to see those patients also. And one patient, when I inquired and seeing all the records, it was like a mumps orchitis. Very 25-year-old female with the ovary, couldn't find out at all, ma'am. But her AMH was 2.5. But in her ovary, it was very few follicles only seen. No follicles also. But her FSH was 22. First one time. She was taking with some Ogician's treatment. There they were given letrozole, clomiphene, letrozole for 10 days. No HCG trigger was done. No follicular study was done for her. Nothing they have done. 2 years they have followed her for the patient.
So you're clear now? You're clear now?
Yes, ma'am. Yes, ma'am. That's what I asked on that day. No. So for that lady, I ruled out TB also. And I told her that, and her husband is 39 years and his semen quality is very hyperviscous, but motile sperms was present. So I told them, you please go for an IVF center. If they ask for donor oocyte or surrogacy, please accept it. Because it will be the case, they will tell you. I gave counseling for them and they went now.
Very good. So you think you benefited as far the male infertility was concerned? You learned a lot. Genetic, male infertility, otherwise causes. And you can take it from me. My experience of DNA fragmentation test says, if the DNA fragmentation test is bad, if it's more than 25 or more than 30, you can take it from me. She is not going to conceive by the IUI. She's not going to conceive with the IVF. The only hope she has is ICSI, and it should be taken very seriously. आपको कभी नहीं कहना कि you are not going to conceive. You can say that there's less likely that you will conceive. You have to put it up that way. You can't say you can't conceive. You say there's less likely. The chances of success is little quite less, but we can definitely try. So I find that a DNA fragmentation is a very cheap test. The total expenditure on that particular test you have to do is something like 700-800 rupees, and you can easily charge, because the labs charge something like 7,000 rupees. So you give a concession, you say, okay, I'm going to do it for 5,000 rupees. You'll find line lag jayegi aapko.
Yes. So I do for my IUI patient vitality test, morphology test by myself, and give the seminal report fully, ma'am. Actually, this DNA fragmentation, I did not know. There is a DNA fragmentation. One thing is there. People who come for giving the media, no man, they was telling me this DNA fragmentation was very tough. We have to see 200 pounds like that. He was telling. I thought something like a karyotyping it will be.
No, it's an easy test. The whole test does not take much of time. In our place, Dr. Rashmi does it, and every day she does 2 DNA fragmentation. So her salary is made out of that DNA fragmentation only. She does.
Now it is very clear, ma'am. DNA fragmentation is best. Whether IUI will be benefited for them or not, we can tell beforehand.
Every time you do IUI, you have to see to it is that you do a semen analysis and look at the semen analysis, and you decide about what technique I'm going to.
Yes, ma'am.
So that is also very clear. So on the whole, you are happy, and you are going to tell in South India a couple of your friends to come and join, because I have trained people from Chennai, from Hyderabad, from Bangalore. Okay?
Sure, ma'am.
Good.